Good evening and welcome to the Henry Schein Dental Academy webinar series. My name is Adam and I'll be your moderator. We're excited to welcome Dr. Nada Albatish as our speaker tonight. Dr. Albatish is an implant and reconstructive dentist as well as international lecturer. In this webinar, she will be discussing posterior composite restorations. At any point during the webinar, if you have a question, please type it into the Q&A section of your control panel and we'll reply via email within 2 business days. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand, and this webinar is sponsored by Ivoclar Vivapen. Dr. Albatish, take it away.
Thank you, Adam. Thank you, Henry Schein, for having me here this evening, and thank you so much to my friends at Ivoclar for sponsoring this education session. Tonight, I'll be talking to you about posterior composite restorations. And what we're really talking about here is how do we reliably and predictably place, bond, polymerize, and polish these restorations in a really efficient way. So before I get right into it, I'm just going to take a moment and tell you a little bit about myself. I'm a mom. I'm a general practitioner. I practice just north of Toronto, and I really consider myself to be an entrepreneur. So everything that I think about related to my practice, including the clinical part of my practice, I really need it to be business friendly. My practice is limited to cosmetic, implant, reconstructive dentistry, and TMD. That's what I do with my own 2 hands. But I do have a multidisciplinary practice where I work with various specialists and several associates. I'm director of the Study Club in the Six. That's an affiliate of the Seattle Study Club based right here in Toronto, and we're starting our first academic year in September. And I'm on faculty with Clinical Mastery Series. You can find us online, www.clinicalmastery.com, and we have online offerings, online.clinicalmastery.com, if you're interested in learning more. I connect with lots of you guys on Instagram. So there's my Instagram handle. If you'd like to reach out to me there, I'm always happy and welcome connections with new dentists. So when we talk about posterior composite restorations, efficient aesthetics is a kit and a workflow that I really love to use in my practice. And since I've discovered it, it's really changed the way that I'm able to move through my direct restorative procedures with my patients. So this is where simplicity meets aesthetics and efficiency. And so I want to take a step back, and before I dive right in, I want to tell you why. Because there's this book by Simon Sinek. It's called Start With Why. It's a wonderful book for business owners, and it really for anybody who's really looking for making connections with people, even your patients, and them understanding why you're doing something. And so as I was thinking through, and as I'm always thinking through my education, I think one of the most important things is for doctors to understand why what we're talking about today is important. And so why is efficient aesthetics important? Why would you consider a change from whatever you're doing in your practice to a new system? And this is the thing. As a general practitioner in a busy practice over the years, what I realized is it's a common occurrence. I'm sitting there, I've prepped my patient, I've achieved my moisture control, I've started to etch, and I'm ready to go on the most technique sensitive part of my direct restorative, which is placing my composite, right? Bonding and placing a composite. And my hygienist pokes her head out. And then maybe the second hygienist pokes her head into my operatory and says, I'm ready for you, I'm ready for you. And at this point, if I'm doing several teeth or a quadrant or a half mouth, it really becomes stressful, right? Because I'm in the middle of doing something that's typically time consuming with conventional composites. And I can't stop because it's also really technique sensitive. So it's not like I can stop in the middle, get up and come back. And so I started looking for something different to make my direct restoratives more efficient, but also still be the same high quality that I was used to. And this is where I stumbled upon the efficient aesthetic system. And this is why I think it's really important for every dentist to understand what's available to you and how much better you can make the direct restorative experience for yourself, for your team who's chronically waiting for you, and for your patients who maybe, feel like things drag on in those circumstances, right? So this is why I think this is very important. So what I'm going to walk you through today is the workflow of doing posterior composite restorations step by step in a really efficient way. And so there's really 6 steps to it. We'll break it down into 6 parts to make it really simple and easy to think about. After you've prepped, and I want to just take a moment and tell you something about prep. If you're thinking about efficiency and prep, one of my program directors in my residency in my GPR many moons ago, his name was Dr. Burns. When I first graduated and I'd be prepping, I would drill a little, look at the tooth, drill a little, look at the tooth. And he came over my shoulder one of my first days in my residency and said to me, Nada, when you start drilling, do not stop to look until you're done. And I looked at him and I said, that's impossible. But I tried it. And that's, if you want efficiency in your preparations, try that. It's kind of a mindset shift. And so look when you think you're done, and that'll speed up your preparation portion. And then what I'll walk you through today is going to make your restoration portion more efficient. So the 6 steps: isolate, then you're going to bond, then you're going to restore with the composite, contour your restoration, cure, and polish. You might think some of these parts are very simplistic to talk about, for example, cure or polish. But if you've experienced any complications with your restorations before, actually every single one of these components is incredibly important, and understanding how they contribute to reliable, predictable dentistry is also really important. So stick with me as I walk you through. We're going to start with isolation. So very simply, of course, the simplest way we learn to isolate that a lot of people stop doing after they graduate is using a rubber dam. And one of the reasons a lot of people stop doing it is because it slows you down, right? So for efficiency, Ivoclar has this wonderful type of rubber dam called the OptraDam. So it basically is a pre-punched, pre-made rubber dam for you. So you can actually set it up in the patient's mouth a lot more quickly, but you will have to punch actually the holes. And then there is an OptraGate. So OptraGate is really just a lip and cheek retractor. It does not have the rubber dam component in it. And this is very possible for you to use on a patient where you think you've got pretty good moisture control if you didn't want to fully use a rubber dam. I'm not here to preach to you about using one way or the other. There are people that do excellent dentistry using lip and cheek retraction. And you can combine this with other products like an Isolite or a Dry Shield. And you'll get really excellent moisture control as well. So you can use it in many different procedures, obviously. So very simply, that's isolation. We'll move right into bonding. So there is an incredible bond called Adhese Universal that is part of this efficient aesthetics workflow that I'm talking you through today. And what this is really, it's a bonding pen. It's called a Vivapen. And there's so many parts to it that are unique, make it easier for you to use, and faster and more efficient, and still really high quality, reliable bonding for your restorations. So basically, it's a light cured adhesive. You can use it for anything from your posterior composites to your anterior composites, even to your veneer bonding and bonding inlays and onlays. And it's really versatile because any type of etching that you want to use, it's possible to use it for. And I'll walk you through that shortly. The really good thing about it being in a pen form and not using a bottle is that you actually get 3 times more applications per milliliter using this adhesive system. You can go directly into the mouth. The tips, of course, change and are disposable per patient, but you can go directly into the mouth with it. It does have integrated HEMA, so it has a desensitizer right in it, which is really wonderful because one of the things related to adhesion and bonding is the creation of postoperative sensitivity. So this addresses that. And I'll show you there's studies showing really high bond strength in any environment, and I'll encourage you to only bond to slightly moist tooth structure, but if your tooth structure was dry or wet, it still has high bond strength. Don't bond ever to wet dentin. Okay. You can cure it through it in 3 seconds. And I'm using this specific curing light that I'll walk you through today, the Blue Phase Power Cure Curing Light. You can actually cure the bond and the composites that I'll talk to you about today, the bulk fill posterior composites, in 3 seconds. And that has been an incredible time saver for me in my clinic, going from 40 seconds, 20 seconds, or even 10-second cures that weren't necessarily as reliable to an incredible curing rate with 3-second cures that really predictably polymerizes every step is just amazing. So it's like, you know, by the time you blink, the curing is done and you move to the next step. Your restorations just really become much faster. So this is one adhesive that you can use for all your etching techniques. So self-etch, because actually it has a self-etchant in it. You can do selective etching, which really just means you etch the enamel first, and then you can either apply your 37% phosphoric acid etch to the dentin a little bit later, or you can just use the self-etch in that adhesive for etching the dentin. Or you can use the total etch technique, which is what we really learned in school. You just etch everything at the same time, 15 to 20 seconds, and you're good to go. And each of these, of course, has a different indication. I'm going to take a second to talk to you about that right now. Self-etching does reduce the risk of postoperative sensitivity because you're not etching with the phosphoric acid etch, and it's a strong etch, and if you leave it on for too long and if you dry it too much, you can desiccate your dentin, and that creates postoperative sensitivity. It works fine for restorations, direct restorations in the posterior, predominantly supported by dentin. For selective etch, you can use this on unprepped enamel. And think about it, if you haven't prepped your enamel, it means the enamel rods are not cut, right? So when this happens, you really need a 60-second etch on your enamel. So you may do selective enamel etch if you're doing like anterior teeth that are not prepped, right? You can also use this technique for direct restorations. If you have a lot of dentin, you're worried about postoperative sensitivity. You can also use it for inlay and onlay. Now, total etch, honestly, we learn in school to use this for everything. So as long as you're not over etching, this really is quite possible to just stick to your same system that you've always been doing without changing it up, as long as you don't have any issues. Okay, so I'm going to walk you through now. The important thing to know about using a really, really good adhesive is that all aesthetics, posterior, anterior, whether you're doing bonding direct restorations or you're bonding indirect restorations like ceramics, all aesthetics are absolutely impossible if you are not using a suitable adhesive. And I'm going to replace the word suitable for you with excellent. You really need an excellent adhesive. You know, bonding adhesion is a technique-sensitive procedure, and it really creates a solid foundation for long-term clinical success for our restorations. So if you don't have a really good adhesive, you can have micro leakage. If you get micro leakage, besides the creation of recurrent decay, you know, opening the window for recurrent decay, secondary caries, postoperative sensitivity, you can also get micro leakage creating staining. And that one of the indications for replacing composites actually is marginal staining, because it means that you have open margins. So aesthetics and even quality restorations are not possible without a suitable adhesive. And this is an adhesive that I routinely rely on in my practice. So really important that I want you to know, and this is really key about Adhese Universal, there are studies that test bonding agents against each other. And in this study, we're able to see that Adhese Universal has a higher bond strength than all other tested adhesives that are in the same category. It was tested on wet dentin, dry dentin, and desiccated dentin. And you know, you really want dry dentin that's not overly dry, so slightly moist. That's the ideal consistency for you to be placing your adhesive on. Because when we do this clinically, you guys, this is not only about having high bond strength, it's also about having no postoperative sensitivity. So we still have to consider beyond the research what happens clinically so that we can give our patients really good results, right? Because you don't want a filling that doesn't fall out, but that hurts, right? So my preference for you and for myself clinically is that you dry that dentin enough that it's still a little bit moist, but it's not desiccated, and we certainly don't want it wet. Otherwise, both wet and desiccated create a postoperative sensitivity situation, no matter what you're using. But the key here is that the bond strengths are really high using Adhese Universal, significantly higher than some of the other bonds that we show here. There is a built-in desensitizing effect, and that really primarily comes from having integrated HEMA, which is kind of like a gluma integrated into this adhesive without you having to add a second step or another material that can weaken your bond. It's already all built in there, and it has the strongest bonds. So that helps to prevent movement of the fluid in the dentin. And we know that movement of fluid in the dentin is what creates the hot and cold sensations. So the other important thing is when your assistant dispenses a drop of bond from a bottle. So when you dispense a drop of bond from a bottle, you're going to take your brush, you're going to dip in, and then you're going to place the bond on the tooth. And whatever's left over is going to be garbage, right? So there's a lot of waste of bond typically in dentistry. And I looked it up for you guys. The cost of a drop of bond today, a mil, not a drop, the cost of a mil of bond today is actually the same as the cost of a gram of gold today, which is a really, really expensive, noble metal. So we really don't want to be throwing all that in the garbage. And if you actually look, there is this study here that shows us that the amount of waste using the Vivapen versus the other adhesives in different types of techniques, dispensing dishes, bottles, brushing on, the waste from Adhese Universal using the Vivapen is very, very, very minimal compared to other bonds. So that's good news for us. So I did mention this to you already. Adhese Universal gives us really the opportunity to efficiently cure it. So you can cure it. And, any material that you're using, you really do need to be aware of the manufacturer's instructions. So in our manufacturer's instructions on our Adhese Universal, you can cure it at a 10-second cure as long as you have the correct light intensity there. But you can also cure it at 5-second and 3-second curing times as long as you have the correct light intensity. And you really want one light that's going to give you all of these options so that you're not going back and forth between different lights. And in my practice, I use the Blue Phase Power Cure for that. So just wait till I show this to you. I'm actually excited for you guys to try it if you haven't already, because it's going to change your life, then your clinical life. The next thing we're going to talk about in our efficient aesthetics workflow is restorations. So our step 3 is to restore with composite. And what I'm going to walk you through today is a full math solution for composites. So you don't have to have a million different kinds of composite in your office. This is one universal solution from the Tetric line of composites that I use in my practice predictably, efficiently, with high quality, and it looks good everywhere. So this is basically an overview of the Tetric line of composites. There are the conventional composites here. You'll see them on the left side of the screen, and then the bulk fill composites on the right side of the screen. Conventional means that it has to be placed in 2 millimeter increments. This is the stuff we learned about in school. 2 millimeter increment, and you cure it. The conventional composites, these conventional composites, you can cure at 5 seconds, at 5-second cures. The bulk fill composites are incredible here because you can place increments up to 4 millimeters for both the flowable and the packable. Conventional also has a flowable and a packable here. So up to 4 millimeter increments, double the increment size, and you can cure them in 3 seconds. So imagine how efficient this could be on your posterior teeth. And I'm going to walk you through what that looks like. So Tetric Power Fill is our packable bulk fill posterior composite. Tetric Power Flow is the flowable version of this. Both can be placed at 4 millimeter increments, and both can be cured in 3 seconds. If you like your conventional materials, or if you have a situation, where you want to use conventional materials, then you have the option to use your Tetric Prime, 2 millimeter increments, 5-second cure, or Tetric EvoFlow, which is the flowable version of this. Okay. So I want to kind of take a step back and talk to you about how to use bulk fill materials. Because as a clinician, And as a graduate of the University of Toronto in 2007, at the time, I was not comfortable using bulk fill materials because we really learned about our conventional composites and about not layering thicker than 2 millimeter increments because of the shrinkage stress on the restoration. So if you remember in school, they taught us and research shows us that if you put in a restoration, let's say you put in even a 3 millimeter restoration with a conventional composite, the stress once you cure the composite, the material wants to shrink. So when it shrinks, the stress created makes your conventional old style composite materials want to pull away from the walls of the tooth. And that is what they call the C factor. And that's why we don't want to place increments that are too thick using conventional composites. So for me to make that shift from using conventional composites to bulk fill materials, the first piece of that was really to understand the science of it. The science of bulk fill materials actually allows us to have lower shrinkage stress than conventional composites in thicker increments. So this science is just better. The technology is just better. And that's why this is possible. And it does not reduce the quality of our restorations. We still get awesome composites with it. And this is how you use it. The first step is you want to use the flowable bulk film material, Tetric Power Flow, and you can use it up to 4 millimeters. So what you can do with this is you can place it even in a 1 millimeter increment if you want at the base of your restoration, just to kind of level out all the nooks and crannies in your preparation so that you have a flat, completely flat, perfectly flat surface to place the packable bulk fill material on. You can cure this for 3 seconds, and then step 2, place your packable material on top of it. Some clinicians actually like to do a 4 millimeter increment with the flowable material and then put a 1 millimeter increment on top with the packable material, the packable bulk fill material. So you can really vary this to your comfort. I actually like to place a thinner layer of the flowable at the bottom. It's an incredible flowable that's self-leveling. So once I place it in, I don't touch it. I just watch it and it just flattens itself out. And that helps reduce the incorporation of air bubbles. My assistant comes in, cures it for 3 seconds, and then I place my bulk fill material on top. These materials have high filler content. They're highly radiopaque, which is incredible. So the flowable and the packable bulk fill materials here are not going to look radiolucent in your radiographs. So here's some tips and tricks I want to talk you through for using these bulk fill materials so that you can be successful, because everything we do in direct restorative dentistry has techniques. And once you get experience with using it, you really learn that you've got these little tricks that maybe when you started out, you didn't know. So I want to share my tips and tricks with you. So the first trick is you want to avoid voids, right? One of the biggest issue with composites is the incorporation of air bubbles at any level, right? If you incorporate air bubbles into your adhesive, into your flowable layer, or into your packable layer, you're risking, in a lot of places, you're risking your patient having postoperative sensitivity. And it's the kind of postoperative sensitivity that feels like biting pain in someone that's not really having nerve pain. So if you've ever had that kind of thing, you've placed a restoration, you had a patient had biting pain, and you haven't been able to figure out what's wrong, most likely you've got an air bubble incorporated somewhere and you just need to replace that restoration. Endo is actually not the answer. I mean, of course, endo will fix it, but it's probably over treatment. So how do we avoid voids? The trick is when you're placing a thicker layer, and no matter how thick your increment is of composite, you want to keep the tip in the composite while you're dispensing. It's really not any different than your analog impression materials. Anything that we do in dentistry, if we remove the tip from the material and then put it back in, we're basically injecting air into it. So what you want to do is keep your tip into your material as you inject so that you're not incorporating air bubbles in. This has been incredible and life-changing for me, warming the composite. You absolutely do not have to do this. It is not part of the manufacturer's instructions. However, for all the composites actually that I use in my office, I love warming the composite. It makes everything more flowable. And that means that I'm less likely to get voids, right? The other thing to consider, you don't have to do this, but you may want to try it because some clinicians love this and swear by it. If you put a thin layer of the flowable before you insert the power fill layer, the bulk fill packable material that we're talking about, if you don't cure it, then what happens is when you inject the packable composite, it displaces the flowable composite and it goes into any nooks and crannies and also helps prevent the formation of gaps, marginal gaps, and air bubbles. The next thing is trust the 3-second power cure system. It is, it's a mindset shift to trust that 3 seconds is working. And the thing is, you can't just use a 3-second cure on any composite. And these composites that we're talking about have a very particular technology, and I'll walk you through that in just a little bit, that allows them to polymerize faster than our traditional composites. So I trust the technology of the system altogether, and it makes me more efficient in the clinic. And I have to be honest with you, my patients are wowed by how quickly I'm in and out of there and how good they feel later. Because it's not that I'm moving faster and they're getting a shot of your job, right? It's that I'm really efficient and they feel fantastic. And that's really what felt so good to me when I started using these materials, and that's why I wouldn't change. Another tip and trick I want you to be aware of for bulk fill materials is you really want to use them only in posterior teeth. Okay, so I'm going to take a moment and I want to talk to you a word about warming your composites. So there are studies that I want to talk to you about that talk about warming composites and what is the effect on the composite itself. Because you guys are clinicians, but you started as scientists. And as a scientist, you want to know what's happening to the materials that you're using. So there are studies that show a range of things. Studies that show that when you warm your composites, it actually improves their physical properties. And there are studies that show when you warm your composites, it causes no change to the physical properties of the composite. What I'll tell you is it improves the handling of all composites I've ever warmed with a warmer, and it makes everything more flowable and all the composite go into everywhere that you want it to without you having to do too much to it. And I love that feeling because it makes me more efficient. And in the worst case scenario, based on the literature, when you warm your composite, the physical properties don't change. In the best case scenario, when you warm your composite, the physical properties improve. So to me, this is a win-win-win situation. And that's why I like warming my composites. So I want to talk to you for a moment about the Tetric bulk fill composites specifically and the advantages, because there are different kinds of bulk fill composites on the market. And when I was doing my research to make myself more efficient with my direct restorative so I can get to my hygienists faster in between my restorative patients, there were some particular things I was looking for that helped me go in this direction. One of the most important things to me when I place a restoration, beyond low post-operative sensitivity and my patients feeling good and the ease of handling for myself, is that when I see these patients back for recalls, I want to see high radiopaque restorations. I don't want to be confused looking at a tooth, whether that is leakage, whether it is my flowable, whether it is recurrent decay, whether it's dentin. And that can happen with some materials where the radiopacity is not different than dentin, right? Or not different than caries, or really difficult to tell the difference. This is one of the most radiopaque materials I've ever used. It looks awesome on recall. So that's one of the reasons why I love it. The second advantage to this bulk fill material is that it has low shrinkage stress. So lower shrinkage stress actually than our conventional composites. It has high mechanical strength because high filler content. So it's just a strong, solid restoration. And really importantly, we can cure these materials in 3 seconds, but we still have a long working time. So when I say it cures in 3 seconds using a curing light, it doesn't mean that you have to work faster, right? So we have a nice long working time so we can sculpt it how we want. But when we cure, we get that 3-second cure, we're in and out and done. The flowable here is self-leveling, and I mentioned this to you already, and it's just an incredible thing to be able to keep the tip in the flowable, place it across the floor, and then just sit back for a few seconds, watch it level itself, and then 3-second cure. And these materials have an aesthetic chameleon effect. So if you look at, there is literature and there is social media, and you see people doing posterior restorations and doing, some really incredible looking aesthetics and posterior restorations that take them a long time to do because they're trying to make these really aesthetic posterior restorations. And the reality is, in your typical GP private practice, we don't have that kind of time, right? Like, how much time can you really spend on an MO to make it beautiful? And the wonderful thing about this composite is that if you're using an A range shade, you just put it in, and once it cures, it actually picks up the color of the tooth. And so that's what it means by chameleon effect. It kind of camouflages with the tooth itself. And so you get a really nice looking posterior restoration. And so this is really an example of what I just said to you. So this is just a typical monochromatic composite versus power fill and power flow. Like, you really can't tell the difference. It blends in really nice. And the reason why we can cure these materials up to a 4 millimeter thickness is because of this type of technology called Essensio technology. And basically what it does is, when you place the composite, it's actually initially more translucent. And when you cure it, it becomes more opaque. So when you initially put it in, it looks maybe a little bit gray. That translucency is what allows the light to get through it deeper than our conventional composites. And then it becomes more opaque. So then you get the nice chameleon effect that you want from an aesthetic restoration. So now I'm going to show you Tetric Prime. So I've talked to you about the Tetric Power Flow and Power Fill. That's what we just talked about. That's the flowable and packable bulk fill composite materials for your posterior teeth. And there are situations where you may want to use a conventional composite with 2 millimeter increment layering. Maybe you're not ready to dive into bulk fills, or maybe you have a particular situation like you want to match to an Emax crown. This material is incredible. Tetric Prime actually has shade compatibility specifically with Emax, which is the most commonly used ceramics on the market today, or one of the most commonly used ceramics on the market today. So that's one excellent thing about it. Also has a chameleon effect, also has high radiopacity, so you can really see that you have excellent margins. And there is, for posterior teeth, if you want to use a conventional composite and just place 2 millimeter increments, it has really great handling, and it has a trans shade, and that is a single shade solution for your posterior teeth if you want to use a conventional composite and cure it after every 2 millimeters. And so here's a sample of the unprepped tooth and then the tooth restored with the trans shade, which is the T shade of Tetric Prime. And you really can barely tell the difference, right? So it has that camouflaging effect, just like the bulk fill materials that we discussed. So here is a good sample of the radiopacity. This is a radiograph showing Tokiyama's Omnichroma versus Tetric Prime. And I'd like to just quickly show you a couple of clinical scenarios here where you can see the use of Tetric Prime here on the canine, and you can see that on the first premolar. And here you can see that it blends in really, really nicely. Like, the marginal integrity is excellent, the color is excellent. And for anterior teeth restorations, it's also, so that's what it means by universal composite, that you can use it in the posterior, but it's also universal. You can also use it in the anterior, and it also blends in really nicely. It really is a nice single shade, or if you want a dentin shade, and then on top of it, an enamel shade, two-shade solution in the anterior as well. And it's much simpler to use than going into really many different steps for trying to match teeth, right? So this is just a really nice way of using a single, simple, universal solution anywhere in the mouth. And this is really all you need in your practice. And here's also a sample in a high aesthetic situation showing you a diastema closure. And this is pretty incredible as an end result. Like, you can't even really tell that this is composite. And the incredible thing about it, again, is that the same composite works for us in the posterior, works for us in the anterior, works in the premolar regions. So we don't need to stock up on a million different things. So we've talked a lot about the composites, the conventional and the bulk fill composites in the Tetric line. Our next step, once we've placed the composite, is we contour it. And this is interesting because some people like to place their composite and just cure it and then drill it later. And if you do that, you end up spending a lot of time drilling at the end to try to polish, an over contoured restoration. So if you take a moment and actually contour your composite before your assistant cures it, then what you're going to find is that you save a lot of time at the end, right? At the end, once your composite's cured. So in this system, the Efficient Aesthetics system, there are these instruments called the OptraSculpt instruments. And I just wanted to kind of take a step back and show you this particular one, because this is my favorite thing. This is one of my favorite things in my whole office. And I use it for many, many different applications. But one of the nice things is the one that's shaped like a round pad. And you can actually use it to tap on those anterior teeth. And with that, you get a really fast, it's non-stick, and you get a fast, nice contour to those anterior teeth without incorporating any little ditches or lines or things you might get if you're using a PFI or plastic instrument. And I just love this for contouring my anterior teeth before we cure, when I'm doing cosmetic bonding. And then when I'm polishing at the end, I don't have to do a lot with my handpiece, which is really nice. Okay, so the options that it comes in. So the nice thing about this is the non-stick effect, right? That's what's really good about it. The optional shapes that you can use in the posterior: a ball, a point, and a chisel. And of course, you can just imagine, ball kind of works like a ball burnisher for packing, but it doesn't stick to your composite. Just puts it where you want it, and then it doesn't pull back on your instrument like some of our other metal instruments may, right? And then a point for creating those fissures, and the chisel is really for creating those angles on your cusps or your marginal ridges. And now we're going to talk about curing. And curing might seem like it's really simple, and you can probably do a half day or full day lecture on curing all by itself, because it is one of the most important steps in your composite restoration, because a bad cure will compromise the integrity of your entire restoration. And the first step in curing really well is using a really high quality curing light. And let me just walk you through my favorite curing light, which is the Blue Phase Power Cure curing light. And it's part of the system. It gives us the option for a 3-second cure, but also you can actually use it with any composites, not just the Tetric line of composites, because it has light intensity at 3-second cures, 5 seconds, 10 seconds, and 20 seconds. So it's really good for any of those things. Also, you can use it for curing cements for your veneers. I use it for both my direct and my indirect restoration. And the main thing about curing that can create a problem, the challenge for clinicians with curing, is actually knowing that we have sufficient polymerization of our restoration. Sufficient polymerization means that your restoration is cured throughout, top to bottom. It's cured the same. We run into problems if your restoration is actually not very well cured at the bottom, but really well cured at the top, right? And that can happen. And when that happens, this is another scenario where your patient will get biting pain, right? And no matter what you do, even if you have like not a very deep restoration, the problems that we get with insufficient polymerization, I mentioned to you biting pain, that's a big one. Any kind of hypersensitivity, you will get marginal gaps, increased abrasion, like increased wear on the restorations, and really just the life of the restoration is much reduced. So what we want to see is composite materials that cure throughout with a light that will cure them throughout. And so With this light and the composites that I've told you about, we get reliable light curing with fewer errors. One, fewer errors because the curing time is shorter. So you don't have to maintain your environment for as long, but also this light, when your assistant, I have my assistants cure, but I actually teach my assistants about curing before I allow them to cure for me. I know a lot of doctors that cure for themselves because they're not trusting their team members to cure for them. But the important things about curing are just stay within 2 millimeters of the surface of that restoration and make sure the light is directly over the restoration. The surface of the light is parallel to the top surface of the restoration. And if you have a restoration on a really large tooth that's wider than your light, then you may need to cure the mesial half of the tooth and the distal half of the tooth separately. These are the things I tell my assistant, and these are bright professionals. So if you communicate these things to them, your team can cure just as well as you can. But it's important for you to know this too up front and be able to communicate it. The cool thing about this light, if the assistant or you is holding the light over the tooth and your hand drifts, which I know we've all seen as clinicians, especially in the posterior, especially if they can't see very well, right? Especially if they're at the very back of the mouth or they're doing an upper tooth. If the light starts to drift off the tooth, this light can actually detect that you're moving away from tooth structure, and it will vibrate to let the operator know to move back onto tooth structure. And it will also add 10% of time to the curing to compensate for the shift, right? For the amount of time that the light wasn't on the tooth. The second thing is if it goes off for too long, it will just shut off and your assistant will know to recure again because the light will just turn off. So it's really a cool technology to make sure that you get a really proper cure, whether you're using any mode, really. So it really works like your lane assist in all our new cars, right? So it just helps you stay in your lane. And if you go off your lane, it alerts you. And that's what I wanted to talk to you about in relation to curing. And the last step in our efficient aesthetics workflow is polishing. And there's an excellent polishing system here, which is also about efficiency. So you don't have to use a million different things to make your composites look nice. We really just want a polished surface that blends in with our margins. And how do we do that? We use the OptraSculpt system. This is for composite, a one-step polish. If you're doing ceramics like veneers, inlays, onlays, or crowns, and you need to polish those, it's a two-step polish and it uses the same system. So part of the efficiency is not just the efficiency of us working in our patient's mouth, it's also the efficiency of our utilization of materials in our entire clinic. So here's the way it works. The dark blue is the pre-polisher. You only need to use this for ceramics, and it comes in all the shapes that you need in polishers. And the light blue is the high shine polisher. And you only need to use this this is the only step that you need for your composites. And this is the second step for your ceramics. So it's literally that simple. 30-second polish. If you're doing a composite, use your high shine light blue polishers. If you're doing a ceramic, start with your dark blue pre-polisher and then move to your light blue high shine polisher. And that's it, you're polished and done. So this is really incredible. And if you've ever tried to get really nicely polished composites and ceramics and tried it in a highly aesthetic way, you know you can go through polisher after polisher trying to get it to look like just right. So we can kind of put that away and just use these very simple polishers to get a really nice aesthetic result efficiently. So here's a summary of why I started today talking to you about why I was looking for a more efficient way to practice in the clinic posteriorly and anteriorly. And I want to finish today by summarizing the reasons why. Number one, simplicity. Simplicity in what we're doing in our patient's mouth, reduce the number of steps in our patient's mouth, reduce the amount of time we're working intraorally, but also simplicity of our inventory. The second thing is that this is a complete mouth solution. These materials, when you actually do the workflow and you use the whole system, you can use it anywhere in the mouth and you actually don't need anything else. One system for everything. Superior efficiency to really anything else I've ever seen. Superior quality, really high quality, moving from conventional composites without all these qualities to bulk fill composites and conventional composite in Tetric Prime that also is simple, has a chameleon effect, has excellent handling. It's just superior quality for the entire system all around. And really the thing that makes me feel safe and comfortable as a clinician is that my restorations are reliable and predictable. I do the same thing every time, and it is predictable in that when my patients leave, I know they're going to feel good. And so thank you very much, everyone, for your time today. I hope you enjoyed this presentation. If you'd like to contact me, if you have any questions about the presentation, or you'd like to reach out to me to connect, feel free to reach me at my personal email here, or find me on Instagram at Dr. Albatish. Thank you very much, Henry Schein, and thank you very much, Ivoclar Vivapen. And thank you, everybody, for your time this evening. Have a wonderful evening.
Thank you, Dr. Albatish, for your presentation. And of course, thank you to Ivoclar as well for sponsoring tonight's webinar. If anyone has additional questions on this topic, please feel free to reach out to Dr. Albatish directly, or you can email us at webinars@henryschein.com. If you're interested in attending future Henry Schein webinars, visit henryscheindental.com/webinars for our upcoming schedule. And a recording of tonight's webinar will be sent to you within 1 week. Thanks for joining us and have a great night.